Dr. Kruthika is going to be presenting visual rehabilitation in keratoconus, seeing clearly with specialty contact lenses.
Good evening, everybody. Today I'll be talking about my paper that is visual rehabilitation in keratoconus, seeing clearly with specialty contact lens. So what is keratoconus? As we all know, it's an asymmetric, bilateral, progressive, non-inflammatory ectatic corneal disease that results in high irregular astigmatism and reduced vision ultimately, which can be corrected conservatively by using either spectacles or contact lenses. When we talk about the contact lenses, in a case of keratoconus, we should be using only the specialty contact lenses. Why? Because we cannot use soft contact lenses, as soft contact lenses take the contour of the cornea, that is the irregular cornea, and hence it gives the same refractive outcome as a spectacle does. Hence, rigid gas permeable contact lenses based on diameter, such as corneal, semiscleral, and scleral lenses, are very useful in treating a case of keratoconus for visual rehabilitation. Aim of the study was to evaluate visual improvement with specialty contact lenses in patients of keratoconus treated post-corneal cross-linking. This was a retrospective study held at a tertiary eye center, wherein 57 subjects were included in the study from the year 2017 to 2021, where BCVA, best corrected visual acuity, was recorded by Snellen chart both with glasses and RGP contact lenses. Data of keratoconus patients treated post cross-linking who were prescribed with specialty contact lenses post C3R were included regardless of age, sex, or any pre-existing morbidity, while those with corneal degenerations or those ocular morbidities hindering the vision, like corneal dystrophy or corneal degeneration, were excluded from the study. The results of our study say that majority of the subjects were in age group of 20 to 30 years, that is around 29 to 40%, and they were all male. So 36 of patients were included in the scleral RGP lenses and 21 of them were in the corneal RGP lenses. When we compared the best corrected visual acuity pre and post specialty contact lens usage, overall, both with scleral RGP and corneal RGP, vision drastically improved. But though statistically not significant, the scleral RGP lenses proved to be better than corneal RGP, though statistically not significant. So the discussion is that RGP contact lenses provide a tear layer between the irregular corneal surface and the contact lens, thus providing excellent vision for patients with keratoconus and improve patients' quality of life. Significantly better visual acuity was achieved with specialty contact lenses as described when compared with spectacles in patients, especially with keratoconus post-cross-linking. There was no significant difference in BCVA between scleral and corneal RGP, as proved by a similar study by Levy et al. So I conclude saying specialty contact lens proved to be a boon for patients with advanced keratoconus, poor visual prognosis, and unsatisfactory visual outcomes with glasses. The study reinstates the gratifying outcomes with specialty contact lens in terms of quantity and quality of vision in keratoconic eyes, and of the two contact lenses that were prescribed, scleral contact lenses were found to be better rewarding and comfortable. Thank you.
So what are the two specialty lenses you used? Was a RGP and a scleral contact lens?
Yes, ma'am. The scleral contact lens
rose
and the corneal.
Is it a rose K lens that you use or RGP?
Ma'am, the rose K we don't practice in our setup.
So, because an RGP lenses are usually not okay for all the kind of keratoconus.
Yes, ma'am.
Because the stability wise and everything, it always fails.
Yes, ma'am.
So either you use a rose K or you'll use a scleral lens.
Yes, ma'am.
Scleral lenses are more comfortable.
More comfortable.
So in your study you did not use any of the rose K?
We have used mini scleral lenses and the corneal lenses that were, it was manufactured by a private laboratory, ma'am. The name is Silverline Laboratories. So we used that in the study, ma'am.
Yeah, because the RGP lenses are usually not very stable for keratoconus.
Yes,
because keratoconus, your cone is little decentered.
Yes,
no?
ma'am.
So it's very difficult to fit it.
Decentration of lens. Yes, ma'am.
Yeah, stability is not good.
Yes, ma'am.
And what was the criteria for you to take the patients in one group and the other group?
Ma'am, we have not taken any grade, as in we have not separated as such. We've taken all the keratoconus patients post C3R. It was a retrospective data. So.
After how many weeks or months of post CXL did you give the lenses?
3 months, ma'am.
3 months.
Yes, ma'am.
Okay. Thank you.
All right. Thank you.
Thank you, ma'am.